Dr. Dave, talk a little bit about why we believe that there is this difference between the ALS specialists or the ALS neurologists per se and some of the non-specialists. Get a little bit more into the weeds of why we think there is this major delay per se.
Yeah, I mean, issue is experience with the disease. ALS is a relatively rare disease with about, we think about 30 to 35,000 people living with ALS in the United States and about 5 to 6,000 new cases each year. A neurologist may go years without seeing someone who has ALS. And so the reason why ALS and neuromuscular specialists, um, sort of what differentiates them is experience and familiarity with symptoms. ALS is difficult to diagnose. There's no one test or procedure. It's only through a clinical examination, a series of diagnostic tests, often ruling out other diseases that a definite diagnosis is established. Our study showed um, uh, that non-ALS clinicians may order, for example, serial imaging tests to rule out other diseases that mimic ALS, or may wait for progression of symptoms because you see a patient once and you're seeing an area of symptoms. You may want to see if those symptoms are progressing or is that a one-time thing. And and they do that to make an accurate diagnosis. On top of all of that, our healthcare system in general leads to diagnostic delays. One often has to wait a couple of months to even get the first appointment with a general neurologist. So let's say a typical person living with ALS had their first symptom, goes to a general practitioner. Maybe that general practitioner is doing a couple of tests and saying need to go see a neurologist. If that patient is lucky, it's possible that that patient is referred to an orthopedic specialist or an orthopedic surgeon, and there might be whole diagnostic delays there because there are tests happening. The orthopedic surgeon, there may even be surgeries that have taken place for carpal tunnel syndrome, for example, but that those were not required because that person has ALS. Um, and then they make their way to a neurologist. And so uh, that sort of waiting for a couple of months to get into a neurology clinic. Then if you see a neurologist, the neurologist is now ordering multiple tests, right? EMGs, spinal taps, muscle biopsies, MRIs. And all of those things take time to make appointments, get the test done, then takes time to make a follow-up appointment with the neurologist so that those tests can be read. So it's an issue with both non-ALS clinicians not knowing what ALS symptomology looks like because of experience, and our general healthcare system where patients are waiting longer and longer to get appointments for specialists. And I think that's what is adding to that diagnostic delay. That's really the difference between specialists and non-specialists, just experience with the disease.